An FDA advisory panel is recommending Pfizer booster shots for people 65 and older or anyone with a compromised immune system. But the panel overwhelmingly voted against recommending the booster shots for the general public. The decision comes just days before the Biden administration hoped to start rolling out a third shot to anyone over the age of 16 who received their second dose at least 6 months ago. For more on this, I want to bring in Dr. William Schaffner. He is a professor of infectious disease at Vanderbilt University Medical Center. He is also a member of the CDC's Advisory Committee on Immunization. It's great to have you back on the show. Welcome. So tell us, what are the main reasons the FDA gave for declining to recommend booster shots for the general public?
Well, I think there were two main reasons. The first is that you don't want to give a vaccine or any medication to someone who really doesn't need it. And young, healthy people, the vaccines seem to be working perfectly fine in keeping them out of the hospital, averting serious disease. That's what they're designed to do. And so they focus their attention on people older than 65 and those younger who have underlying conditions, heart disease, lung disease, diabetes, and the like. The other reason is the main focus for curbing this pandemic should continue to be on people who haven't yet received their first dose. And so we have a limited amount of bandwidth, that we can devote to vaccine promotion. And they said, let's focus on getting that first dose into people who haven't been vaccinated at all, and then very carefully rifle our boosters to the people who need it the most. Down the road, they may change their mind as circumstances change, but that's the current plan.
Dr. Schaffner, you are part of the CDC's Advisory Committee on Immunizations. How is the FDA's decision now impacting you and your colleagues who are making decisions on the booster shot? Is this because of this recommendation, is the CDC's answer made?
Well, on Wednesday and Thursday, the CDC's committee will meet, and my colleagues who vote on it have already kind of expressed themselves at their last open meeting. Interestingly enough, they're moving pretty much in the same direction as the FDA committee. So I think there'll be harmony there. That's my anticipation. We'll get those formal recommendations. Who should get these boosters and when? I think Thursday afternoon.
All right. I really appreciate you explaining that there's still a group that should be getting their third booster shots. They've been approved for it. It's likely that the CDC, after that meeting, will make the same recommendation that the FDA did, which is people who are immunocompromised or over the age of 65 and received the vaccine in the early part of the rollout. Because I think so many people have been focused on the surprise that the FDA didn't recommend it for the general public. But you said that you think that the FDA may revisit this in the future. So tell us when you think that's going to happen and what the FDA will be looking for in terms of the science, in terms of the data.
Well, let's all watch the science. There are two important issues. The first is, how well are the current vaccines protecting against serious disease? If that begins to wane in the future, even for healthy people, that will be one indication. Another would be if there's a new variant of the virus that's out there that requires boosting in order to protect against that new variant. So everybody will be looking at those two things in particular.
Real quick, I want to ask you, as you mentioned, the first shots are the most important. Where are we standing with children under the younger pediatric vaccine? Are we expecting that soon?
We hope so. Let's remember, every child and every person actually age 12 and over is now eligible for vaccination. And we've got a lot of children, adolescents to vaccinate still. But for those younger than age 12, those data will be coming in later in the fall, earlier in the winter. We'd all look forward to that to see whether the vaccine's safe and effective. I assume it will be in young children also.
All right. Dr. William Schaffner, thank you. Thank you also for all that you do.
Thank you.